Welcome. Thank you for being here today. I'm Dr. Perkins, a board-certified OB-GYN, and today we're talking about can hormonal imbalance cause infertility? I get this question all the time, and it's a very, very important one. So today in our video, we will talk about hormonal imbalance and what it is. We'll talk about the female and male factors that plays a part with infertility, and we will talk about the treatment options and the ways that we can approach infertility as well as hormonal imbalance. So let's dive into it. Infertility on a whole is defined by attempting to conceive for 12 months if you're under the age of 35, or 6 months if you are above the age of 35 and conception has not occurred. About 10 to 15% of couples experience infertility. Now, I'm going to mention here that of all those couples, probably 100% of these females may think that the infertility is due to a problem in their system. I can't tell you how much as females we carry the burden of being responsible for reproducing when the field is actually shared equally by males and females. To be clear, infertility is 50% due to a female issue and 50% due to a male issue. And so know that this is truly a team approach to figuring out what's happening internally. And so I'm going to talk about both sides of the coin. From the female standpoint, there are many different things that can lead to infertility. And so I'm going to show you my model here. A lot going on here. Vagina, uterus, fallopian tubes on both sides, ovaries. This is a reflection of your internal reproductive organs. And every single part of this may affect fertility. That is the journey between egg and sperm that needs to merge and fertilization occur so that life can develop. If there are issues in the vagina, we may have infertility issues. And sometimes it could be you have a double vagina or a blind vagina, a vagina that doesn't connect through to the rest of your internal system. It could be that we have infections and issues in your vagina that stops sperm from being able to survive and pass through. So a lot can happen here. Then the bottom part of your uterus is called your cervix. This area is open to the inside, and this is where blood passes through at the end of your cycle or during your cycle. Sperm needs to pass through to get inside. If there are blockages to your cervix or anything that prevents sperm from coming through, that can cause an infertility issue. When we think of the uterus is, I'm going to say a large space, but I say that to say that many different things can affect the uterus itself. We can have fibroids, which 50 to 70% of females have fibroids, whether or not it's known, it exists. So fibroids can interrupt the internal status of your uterus and make it very challenging for sperm to either get through, or for egg and sperm, if conception has occurred, it can prevent them from implanting well. We know that fibroids love blood flow, so it can steal blood away from the areas inside of the uterus that is important for blood to be to help with fertilization and implantation. There are other structural things that can happen inside as well, such as a polyp, for instance, which is a growth that can happen on the inside of your uterus or your cervix. But this can block sperm from coming through or from egg and sperm meeting and implanting inside of the uterus. We can sometimes have an issue with the uterus itself, the muscle of the uterus, where it is not functioning well because of endometriosis or adenomyosis. A lot of changes can happen here. We may also have issues with our fallopian tubes. We can have blockages there. Sometimes we can have water or liquid that is completely overwhelmed our fallopian tubes and they're not functioning, they're not open anymore. And then of course, we can have an issue with our ovaries, okay? Our ovaries respond to hormones. And so we can have conditions like PCOS. We can have issues such as anovulation, where we don't ovulate regularly. We can have a lot of things where if the eggs are not being released from the ovaries, we won't be able to get pregnant. And so that's just some of the underlying issues that can come from the female standpoint. Now, when we talk about men, they may have issues with their sperm. It could be their sperm count is low. So when we think of an ejaculate, when we ejaculate, in one ejaculate, we often would have up to even 4 million sperm in one ejaculate. That's a lot of sperm in hopes that one will get to the egg. But what we know overall is that if that count is low, if we're under 100,000, if we're even less than that, it may be challenging for pregnancy to happen. Or we may have a good sperm count, but the motility of each sperm isn't there. And so the sperm can enter into the vagina, but doesn't go anywhere. And so pregnancy will be a challenge there. Males can also have hormonal imbalances that may lead to their sperm not being healthy and good quality sperm. This is why I like to just mention that infertility is equally male and female involvement. Now, if we pivot back to a female system, we have our estrogens or progesterones, the main female reproductive hormones. We also have testosterone, which is really important, but it's just in a lesser amount compared to males who their system and their hormones are highly regulated by testosterone. And they also have estrogens and progesterones, but in a smaller quantity. We also have our follicle-stimulating hormone from the brain and our luteinizing hormones. And we track these from month to month when we're trying to be fertile. And any imbalances in any of these hormones can truly lead to infertility. A balance between these hormones is super important for ovulation, implantation, and for pregnancy to be maintained for all of, I'm going to say 10 months, because that's how long it is, 40 weeks. But socially, we say 9. So if I say both of them, just know that we're talking about the same pregnancy and a normal length of time. Common imbalances that we see is, first off, PCOS, polycystic ovarian syndrome, which is an underlying hormonal issue. We also know that thyroid disorders may also cause a good amount of hormonal imbalance, but also infertility as well. It is important that our estrogens are in their right amounts. And when you see an infertility doctor or an OB-GYN, we often will check your level of your estradiol because we know that estrogen is important for producing your eggs, for ovulating, as well as creating the perfect internal environment inside of your uterus for implantation to occur. Progesterone is another level that we will check, and progesterone is really important for maintaining pregnancy as well. It is actually what I consider to be the building block of pregnancies. It is super important for your progesterone from the moment of conception to increase to normal levels or pregnancy supporting levels in order for that pregnancy to continue. If for some reason we have insulin resistance, it may be very challenging to become pregnant. Making sure that we are not in an insulin resistant state will help us to become more fertile overall. Now you may be wondering, well, how do I know if I have a hormonal imbalance? Outside of testing, which know that testing your hormone levels isn't always a full reflection of your total and overall hormonal imbalance or possible imbalance. What I'd rather focus on is what you're experiencing. Are your cycles regular? If you have irregular cycles, that is by definition and a reflection of being hormonally imbalanced. Even if your estrogens and your progesterones and your LH and your FSH are all perfect. If you suffer from having a lot of acne, especially around your jawline, this is reflective of having hormonal issues within. If you struggle with weight changes, especially weight gain, this is also heavily linked with being hormonally imbalanced. We want to really investigate all the things and symptoms and signs that you have, because I often say that patients have the answer. Yes, we do all the testing and imaging and all the things to quantitatively get answers. But if we really pay attention to the things that we're feeling and what we're experiencing and discuss them with your provider, it actually gives us more information and help us understand your playing field much better than the labs do. I want you to see a provider. If you're concerned about being hormonally imbalanced, I want you to go and see your doctor. Talk about these things. Let's get the blood work and testing done, but really, let's have a conversation about your experiences and your lifestyle so we can really help you where you are. Listen, as hormonal as we are as people, it can be really confusing. There's so many different things happening, and I want to help you with that. I wrote my ebook, Hormones Don't Lie, for you, and I'd love to send you a copy of this. If you would like that, please click the link below this video and I'll send it right over to you. I'm here to help you on your journey and to try to figure out what's happening, but more importantly, to try to fix them. Thank you so much for joining me today. Please join me next time.